A study released by researchers at UMass shows that critically injured soldiers are at greater risk of mental health disorders. The researchers looked at thousands of cases of military members injured in combat in Iraq and Afghanistan from 2002 to 2011. Carolee McGrath sat down with David Chin, Assistant Professor of Health Policy and Management in the School of Public Health and Health Sciences, to learn more.
The study came of an effort that started in the war in Afghanistan and Iraq, where actually an in-the-field physician decided he was going to collect information about these critically injured soldiers. So it started as this kind of one-person project on a laptop in the field, and became what's known as the DODTR, or the Department of Defense Trauma Registry. The study was motivated by trying to understand the actual long-term outcomes of soldiers who have been severely injured. So there's quite a bit that's known about traumatic brain injury and the outcomes in mild and moderate traumatic traumatic brain injury, or TBI, but very little is known about severely injured soldiers. So that was kind of the main motivation for looking at this group of patients.
And when you talk about severely injured traumatic brain injury, can you just give us a little bit of a distinction between the two?
You can think of mild traumatic brain injury as the type of thing like a concussion. So the type of things that maybe kids get on a soccer field, or maybe in a sort of football game, something that causes this kind of acute injury but doesn't have any necessary, obviously, long-term impacts. And the severe are these really extreme cases where you have penetrating injuries to the brain or crushing injuries. These are folks that are severely injured and that require sort of intensive care treatment for months and months. So they're a different group clinically when compared to the kind of conventional work that's been done on TBI.
Okay, and so when you did your research, you're really looking at, just the long-term mental health outcomes for somebody who's recovering or recovered from a severe TBI. And so what are some of the things that you found as you did your research?
So one of the things we found was that contrary to some of the conventional wisdom, which was that when patients have a severe brain injury, that has some kind of protective effect. So in other words, folks thought that when you had a severe injury, you might sort of have this amnesia or sort of amnestic effect. And what we I think showed was that doesn't seem to be the case. In fact, that as you have a more and more severe traumatic brain injury, the incidence of having a mental health condition increases.
Including PTSD,
yes,
which was part of your research, right? Why was this important to you to look at this particular area?
This topic is of great interest to me because my research focuses on marginalized populations, and I have a particular interest in social determinants of health, which this study doesn't directly get at. But there's a well-established gap in the care of active combat soldiers as they transition from being in service to the VA or into private care. And there's a stigma attached with mental health diagnosis. And while I don't think that we really were able to really understand how the stigma had an impact on our study findings, it was an important thing for me to try to learn more about and also try to shed some kind of insight on.
Yeah, and when you talk about a stigma attached to that, certainly, with men and women coming back, maybe not wanting to share, some of the things that they're struggling with. So this research certainly highlights many of the different things that they're experiencing. Where do you think you go from here with this?
I think to have a real definitive understanding of what's going on with patients that sustain severe injuries, there has to be a more systematic way of this information being captured. So what we were able to do was examine all of the information in the Department of Defense sort of health records registry, while acknowledging that this doesn't connect to the Veterans Administration's information at all, nor does it does it connect with any of the private sort of sector information. So we don't really know what goes on once folks leave the Department of Defense sort of health system, and systems need to change to be able to connect these pieces together so we can really learn about what's going on.